In 2006, 73-year-old Trenton Sawyer was the epitome of rugged masculinity. For most of his adult life, he worked in one of the most dangerous jobs in the world, mining coal in the mountains of West Virginia. Although Trenton was repeatedly rescued from cave-ins and gas leaks, he later retired from the mines and became a Baptist minister. Despite his dangerous past and imposing appearance, Trenton was known as an unusually gentle and calming man to his parishioners. He was also known as a devoted grandfather who was always willing to set aside his duties to spend time with his grandchildren. In January of that year, however, a striking change happened to Trenton. He went from a respected man to a paranoid man suffering from a disorder. It all began on a January afternoon when Trenton suddenly erupted into uncontrollable screams, as if something terrible was happening before his eyes. His wife Ruby tried desperately to understand what was happening, but Trenton couldn't speak, just stared ahead with wild, terrified eyes. It turned out that a few months earlier, Trenton had undergone a medical examination due to severe abdominal pain. Doctors determined that the gallbladder was the likely culprit of the pain and scheduled him for surgery on January 19th. Trenton agreed to the surgery, trusting the medical professionals to give him the care he needed. During the surgery, a nightmarish scenario unfolded. The anesthesiologist, a young and cocky resident named Coleman, administered only one of the two necessary anesthesia drugs, leaving Trenton paralyzed but fully conscious. When the surgeons began the operation, Trenton endured 16 excruciating minutes, feeling the scalpel cutting into his flesh, his organs being manipulated, yet completely powerless to do anything. The searing pain and incredible horror surpassed anything Trenton had ever experienced, even during those difficult days as a miner. When the medical staff finally realized that Trenton was awake and aware of what was happening, he was immediately injected with an amnesia-inducing drug in hopes of erasing his memories of the shock. However, the damage had already been done. Trenton was released from the hospital a few days later, seemingly unscathed, but the psychological scars remained deep. Upon returning home, Trenton began experiencing debilitating panic attacks and vivid hallucinations without realizing their cause. He would wake up in the middle of the night, drenched in sweat and convinced that unseen forces were closing in on him. Ruby and his children tried desperately to comfort and support him, but Trenton sank into a state of paranoia and despair. 2 weeks after the failed surgery, Trenton committed suicide, unable to bear the psychological torment any longer. Only after his death did his loved ones learn the horrifying truth about what he had endured during that fateful surgery, prompting them to seek justice and compensation from the hospital. Trenton's story has since become a call for improved patient safety protocols and better oversight of anesthesiology practice. His surviving family members lobbied tirelessly for legislative reforms, determined that no one else should have to endure the agony that Trenton endured. They testified before congressional committees, organized information campaigns, and even filed a high-profile lawsuit against the hospital, demanding that those responsible be held accountable. The case has received national attention, drawing attention to the problem of medical errors and the devastating impact they can have on patients and their loved ones. Expert witnesses described the systemic failures that allowed Trenton to go through the ordeal, from inadequate training of anesthesiologists to a culture of complacency in the medical establishment. Ultimately, the hospital agreed to a multi-million-dollar settlement, which the Sawyer family used to establish a foundation in Trenton's name. The Trenton Sawyer Patient Safety Foundation became a driving force for change, advocating for stricter regulations, increased transparency, and better support systems for victims of medical malpractice. Although Trenton's life was cut short under such tragic circumstances, his legacy lives on through the reforms and initiatives his loved ones fought for. Their unwavering dedication ensured that his sacrifice was not in vain and that his story will continue to inspire others to demand higher standards of medical care. In his life, Trenton Sawyer faced the most dangerous of dangers, but was destroyed by the very system that was supposed to protect him. As a result, his death has become a symbol of resilience and a catalyst for meaningful change.